Hi, my name is Chelsea Keenan, and I'm here again with Professor George Wehby. He is a faculty member here in the College of Public Health and the Health Management and Policy Department. Dr. Wehby is going to be giving the 2019 College of Public Health Distinguished Faculty Lecture here later this week, so thanks again for being here with me.
It's great to be here.
Yeah, so in our last interview, we talked a little bit about the lecture you're going to give, and you talked about poverty, child health, and minimum wage. Can you give people a little bit more background about your research?
Yeah, so my work has largely focused on understanding social and economic determinants of health, especially children's health, and most recently examining effects of the minimum wage on early child health, like the birth weight and gestational age, but also some early childhood development outcomes as well.
Absolutely. And then what do you see as some future directions in your research?
Yeah, we would like to examine more recent changes in the minimum wage, some of the bigger changes that happen in some states or cities, and then to examine longer-term outcomes going through childhood, but also adolescence, and behavioral, emotional, and physical outcomes as well.
Well, thank you so much, Dr. Wehby. I'm really excited to hear more about what you have to say in your lecture later this week.
Thank you.
And as a reminder, the lecture is going to take place on October 23rd. That's Wednesday at 12:30. And it's going to be here in the College of Public Health, so please plan to attend.